So, Dr. Rahul, my question to you is that, when monsoons come in, and if somebody has fever, how would you approach fever on day one and day two?
I think that's a very important question, sir. So when a patient comes to us now, we were only thinking of fever and to rule out COVID. But now you have many alternative diagnoses, which are actually very commonly happening in the population. So my first diagnostic approach would be actually history taking. I would like to take a history of the patient very well. So generally, what we see is that the fever, apart from COVID-19 right now, if they are a pathogen which is involving the upper respiratory tract, like influenza or H1N1, is also associated with a significant amount of cold and throat pain. And along with that, fever is there. So that's one of the histories which we could look for. The other thing which we could look for is that absence of any throat pain or cold, just high grade fever, very high grade fever, up to 101, 102. Then you have to start thinking in terms of tropical illnesses like malaria or dengue. Because generally, COVID illness, COVID fever is not very high grade within the first day or two. It is associated with a significant amount of body ache, headache, a little bit of a fever which goes up to 99, 100.2, 100.3 degrees Fahrenheit. Generally remains in that stage. I would also then look at a thorough clinical examination looking for any signs of rash. Rash can be confounding here. And obviously, I would look at patient's heart rate, blood pressure, tachycardia, and saturation, and then based on that, order some investigations. Rapid antigen would probably be the first step to do and rule out a COVID 19 antigen. It does not rule out effectively, but if it is positive, then I know that I'm dealing with COVID. And then I will get a RT-PCR done, and along with that, I will probably get a fever profile included as well. A fever profile would be a thick and thin smear peripherally, a rapid malaria antigen test, a dengue IgM, or a NS1 if it is day one or day two, and that should give me enough diagnosis right now to sort of look forward to what am I dealing with. But these are the problems, sir, that we are actually facing right now, and it requires a little bit of a diagnostic skills and a history taking skills to come up to a diagnosis. As opposed to 2 months ago, every fever was COVID unless proven otherwise. Now it is probably not true. You still have to rule out COVID, but you also know at the back of the mind that it could be something else.